menstrual. If it affects the nerves and blood vessels, then obviously they can have pain and discomfort in the pelvis. But there are also few women where the disease goes beyond the pelvis and go to the brain, so they get a lot of headaches or migraines during periods. Some of them get seizures. Then it can go to the lungs, so that when women are menstruating, they have they cough blood or they get blood filled up in the chest, they can't breathe. You have those where it goes to the ear, nose and throat, so they can have blood running through their eyes and ears during menses and go to the joints, causing menstrual arthritis. So endometriosis goes everywhere. That's why we said it's a disease without a lobby.
Doctor, I think many
and all these are complications.
Many women have gone through that, and I think this issue of it has taken me back to the things of UTIs, infections, UTIs. Could it be that this kind of disease is not easily detectable? But I think it is hard to detect because most women actually are suffering from infections and UTIs. Could it be the disease that is causing that?
Yes. The bigger majority, almost 50% of women moving around town with cannula, moving around town, taking antibiotics,
tubes.
And they attribute it to UTIs. So women love UTIs and doctors love UTIs. It's because they're ignorant. It is ignorance of the disease that has caused women to go through a lot of this trouble. So the health workers are not very comfortable with the diagnosis of endometriosis. A lot of them for sure do not know about it. Even the experts, even those we call experts, the specialists do not know much about the disease. And this is the reason why we come out to speak to not just patients, but we also speak to the health fraternity that they have caused a lot of harm. One, by missing the diagnosis early, but also two, by treating it wrongly and failing to diagnose it. It takes knowledge and training to be able to suspect endometriosis, but we usually say every woman who has those symptoms we talked about, there should be suspicion of endometriosis and extra effort put to catching it early. But this time around, we're not using them as family planning methods, we're using them as treatment because they are hormones. So we use those hormones in those methods, like a pill is the common one. We give them a pill to stop their period for some time so that we give them a break and avoid this cyclic shedding and spread of the cells. So for us, we use them as treatment. They are not a cause of endometriosis anyway, and they are very helpful.
Okay.
Yeah. And sometimes there's a lot of myth around them. Some people think they will delay fertility in the future. Others, of course, believe that when you give teenagers these drugs, then they will have unprotected intercourse, which will lead them to maybe other illnesses. That can be true, and of course that is correct, but we look at the bigger picture.
Okay.
We look at the bigger picture. The wrath of endometriosis is worse than those that can be controlled.
Okay.
So we usually counsel the parents quite much about the use of these drugs, not given for family planning, as I said, but they are given to stop the uterus from menstruating a given period of time. Then we give them a break. They can menstruate once in a while, and we keep like that for some years.
Okay, doctor. So apart from the genetic part, that maybe someone can have endometriosis because of the gene risk of the parents, what are some of other causes that can lead to endometriosis? Largely,
the cause of endometriosis is unknown. Largely, we believe in theories that have a lot of theories have been looked at, a lot of research has been done. We are still, hypothesizing why some women get endometriosis and others don't. There is no single particular cause that we look at. But among the risks, as I said, is the genetics, the family issue. Is there anyone in the family who once had endometriosis? Then the siblings are more likely to have endometriosis that is stronger. Number two is what I talked about, retrograde menstruation. Women who are born with uterus that contracts severe than the others will have higher chances of bleeding backwards and eventually get menstruation. There are risks like diet, diet rich in estrogen. Estrogen is a hormone that builds the uterus faster. It is the same way women get fibroids. So if the diet is not good and it is rich in those estrogens, like for example, a lot of poultry these days, they use a lot of estrogen to grow these in the poultry industry and the agriculture industry. So somehow it gets into the diet of most women. And this estrogen largely contributes to the growth of endometriosis and fibroids and diseases in that category. Then we usually think of risk factors like overweight.
Overweight.
Yes, overweight.
I'm worried.
So when you become obese or you grow fatter, then your body produces a lot of bad chemicals that will increase the levels of estrogen and work on your uterus. So you have risks of endometriosis, cancer of the uterus, and all those things. Lack of exercise, of course, all of these are things that look around the behavior and the lifestyle. So lifestyle has a lot of it has a lot to do with most of the diseases that affect women. Smoking, too much alcohol use, and now we know that there are some infections that can affect the intestine that can contribute to endometriosis. So a lot of research is going on, but what we know for sure is that women or these young girls who start complaining of pain early are more likely to progress from endometriosis in the next 8 years. So that is stronger. Yes.
So what happens if someone has had all her lifetime? For example, I am 40 years old and I've had those pains since the age of 18 years. What happens? Is my uterus going to blot out? What could be the hardest effect that a woman can go through or can have as a result of endometriosis?
Of course, endometriosis, as I said, is an aggressive disease. It affects the woman's reproductive system. And we're talking about the uterus, the ovaries, the tubes, the surrounding structures. There are many things in the pelvis. The intestines, the nerves, blood vessels. So all those are inside the pelvis of a woman. The pelvis of a woman is compacted with all those things. So the first thing that usually happens is that if it affects the uterus, more likely women are going to get, first of all, the challenge of having pain every month is devastating because they lose a lot of working time, they lose relationships, they have sexual pain, marriages break. So socially and psychologically, it is a big problem. But also because it affects the uterus and tubes and the ovaries, they eventually get infertile. Most of them, actually 50% of them, cannot conceive, and that's a big thing. And infertility is largely caused by endometriosis in young women. Every 10 women you see who have infertility, 5 of them is going to be as a result of endometriosis or adenomyosis. That's for sure. So the burden of infertility is high in these women, and whatever comes around with infertility, psychological, social, financial, is a big thing. But also if it affects the uterus, then more likely women are going to bleed abnormally. They can bleed much heavy bleeding, they can have prolonged bleeding, they lose blood, they're anemic, and also that is a problem.